So, shall we get started, Michelle, or? Yeah? Okay. So, first of all, I'm Congressman Tom Malinowski. Thank you all so much for joining us for this session, and thanks in particular to our panelists who are all experts in doing wonderful work to try to improve access to child care for families in New Jersey. Since we advertised this forum, I've been hearing from a lot of people across my district, many of whom couldn't be here today, possibly because they have child care issues. About the problems that they're experiencing. Problems of accessibility, for example. I've learned that in our congressional district, I've got about 75 towns. About a third of them are considered to be child care deserts, in the sense that there are not nearly enough licensed child care facilities to meet the needs of the children who live in that town. And then, of course, affordability. The typical family in New Jersey with one infant child spends about 12% of their income on child care. And if you are a single parent, it shoots up to about 50%, which I think anybody can see is completely unsustainable. So today we're going to hear from our panelists about policies that have been put into place, that should be put into place, that might help. And we're also going to talk about just the state of the child care industry in our part of New Jersey as well. I'll have some questions for them, and then we'll open it up to the audience. Hopefully we'll have a very interesting discussion. So from there, I'm going to turn it over to you guys to introduce yourselves, maybe starting with Riley.
I'm not sure if everyone can hear me. I don't know that I project as well as Tom does.
Well, then use the mic.
Is it on? Can everyone hear me? Yeah? Okay, so my name is Riley Parsh. I'm a councilwoman in the town of Clinton in Hunterdon County. I also formed a company right after I ran for office called Moms Running, and the mission of my company is to get more moms engaged in the political process. And so one of the barriers to entry that I found immediately upon forming that company is that most moms find it hard to run for office because they have childcare issues. And so, of course, that's one of the reasons that I'm here today to talk about childcare access. So my background, I have a background in law, but I'm not a practicing lawyer at the moment. So I'm excited to be here to talk to you about this. I'm going to leave a lot of the in-depth policy discussion to the experts to my left. But I do want to talk a little bit today, hopefully when we get to the question portion, about what it means to be a parent trying to engage in the workforce when you don't have access to affordable childcare. So thanks for having me, and I'm excited to have this conversation.
Thanks.
My name is Laura Mickley, and I am the program director at Norwest Cap Child and Family Resource Services. So we are the child care resource and referral agency in Sussex, Warren, and Hunterdon counties, and that is under a funding of the Division of Family Development. We do administer the child care subsidy program in those counties. We work with early educators on enhancing their skills and practices. And we also work with families not only on finding child care resources, but in a more holistic approach and connecting them with the resources at Norwest Cap as a community action program at large and in the community. So we really work with each individual family on finding out what their needs are and connecting them with resources in the community.
Good morning, everyone. I hope can you all hear me?
Yes.
Great. I'm Elisa Naida, and I am a Deputy Commissioner at the Department of Human Services in the state of New Jersey. I'm really happy to be here today, and I thank the Congressman for the invitation, but also to you and your staff for making this space available to talk about an important issue, which is childcare. In our administration, in the Murphy administration, we recognize that this is an important issue for families in New Jersey, for families with low incomes, and working families in our state. I'm so glad to see some of our partners, Cindy and Diane, We have been doing critical work with them. We have formed an advisory council. We have been talking to parents directly so that our policy is shaped by that direct community engagement and hearing directly from the people that are using our services. And so I hope that today's discussion you'll be able to learn a little bit of the things that we are doing at the state level, but also an opportunity for me to take what I hear from here back as we continue to think about policies that are going to help families as we move our work forward. We know how important it is to build a stronger and fairer New Jersey, and for economic development, to make sure that people have access to childcare, and for parents to have that peace of mind that they need, knowing that your child is in a quality learning environment. So I'm happy for this conversation today.
And I'm Mary Jane Apollo, and I work at the Community Child Care Solutions, which is the child care resource and referral for both Middlesex and Somerset County. So I know the Congressman has a large area to cover, so we work with our partner Laura as well as our partner Four Cs, which is in the back. So we also do the same thing. We help people find childcare. People can call us whether you live or work in any of our counties, and we can help you find childcare. We can also help you pay childcare if you're eligible for our subsidy program. And in addition, we help to recruit, monitor, and register family childcare providers, which is a great option for people that might work non-traditional hours of care or can help us fill in some of the areas that are the desert. So there is a child care resource and referral in every county in the state. So that's what we do.
Thank you guys so much. So let's begin with the most basic question, the question of cost, and maybe start with you, Riley, and maybe Elisa as well. Maybe talk to us about the cost of childcare in this area, the burdens that folks are facing. How do we compare to other parts of the country? We'll take it from there.
Okay, so I think I can speak to my personal experience a little bit about the cost of childcare first in the region. So when I first had to think about childcare, we're a fairly middle income family, and I thought, okay, well, I'll put right now I have a 7 and 3-year-old, but at the time I had she was 2. I had one child and she was 2, and I thought, well, we have a reasonable income, and I'll just go and I'll put my kid in childcare. It'll be no big deal. I'll go back to work. So I started talking to childcare providers in my area, and as I said, I live in Hunterdon County, which is, as everyone I think in the room probably knows, a fairly affluent county. So I didn't think it was going to be cheap, but I did not believe that it would be another mortgage payment. And so I started talking, and I thought, well, $2,000 a week or a month seems like a lot of money to be able to go back to work for not very much money. And so I did not go back to work. And so I think one of the comparisons we could make, and I won't extrapolate that out to the rest of New Jersey. I'll leave that to my counterpart, who I think is probably better informed to be able to do that. But what I will say is it limited my ability to go back out into the workforce, because I would have been essentially making a paycheck to pay my childcare provider, and that would have been where all of my money would have gone. And these were all, this was the standard cost of childcare at the time across the board. It would maybe varied $100 here or there, but it was the cost. And it was every kind of childcare provider I could find, whether it was in-home or in a childcare center, or a nanny, or any of those various things. It didn't vary significantly amongst the different types of providers. And I think that based on my conversations with the plethora of women I've spoken to, that is the experience across the board for women it's certainly within our district, but within the state of New Jersey, that it's a choice of, do I go to work and I make money to pay childcare, or not even enough money to pay for the childcare, so I'm living paycheck to paycheck, or do I just not go back to work, and then I have a resume gap to deal with. So that's my personal experience and the lived experience of people I know and have seen. But I would turn it over to my counterpart to speak to the specifics of the cost.
Sure.
Yeah, absolutely. And Mary Jane, she brought a really helpful sheet. I brought our market rate survey, which we do. The last one we did was in 2018. Union County has the highest childcare costs. We also know that, in our state, we know we're sort of divided by regions, and sort of the cost of childcare varies within those regions as well. But one of the things that, before we sort of get to what that cost is for infant and toddler and preschool and age school, what we heard loud and clear from advocates since the minute we stepped in our doors was our payment structures. For the longest, we have been paying the same rate for infant and toddler care. We all know, and those of you who are parents know, that caring for an infant just is going to cost more. You need a different staff ratio, you need other equipment in your classrooms, you need cribs, you need things for infant care, and that was a significant issue, and probably one of the reasons why we're here where we are right now, where there are certain areas in our state where there's just not enough infant care. And so parents go to Mary Jane and go to our CCRNRs and are having trouble accessing infant care. So one of the first things that we did, and I'm so thankful for the advocates who brought this to our attention very early on, and for the work that you do on the ground, because you're really doing the research, you're getting out there talking to parents, saying to us, you need to fix this. And so we decoupled we fixed our payment structure, and we decoupled infant care and toddler care rates, and we have made significant increases to infant care. In 2 years, we have nearly made that increase by 40% across the board. And we're still behind, right? But we're moving the needle. And so I just wanted to make sure that you sort of know that is something that we have done in the administration to incentivize, but also to pay the right amount for those that are caring for infants. And we have built some incentive strategies for childcare providers to increase that capacity. Now we know the challenge that it is to sort of build a classroom for infants. You need cribs, you might need to knock down a wall, and so there are other expenses that come with that. We have been able to move the needle a little bit and have been able to increase that capacity, not by as much as we would have liked, but we're moving in the right direction. I think we are at a place now where we're really trying to continue to work with providers, to continue to work with the stakeholders, to figure out other strategies to continue to support providers to increase that capacity so families have access.
Now, I just wanted to say that the cost of infant care in Somerset County annually is $16,588. So that's a very significant amount of money, close to a college education. So if you work and make the minimum wage or just above the minimum wage, you just have money to pay for your child care, never mind those pesky things like rent and food. So it really is very urgent, and I do applaud the commissioner because I think we are moving in the deputy. Maybe you're getting promoted. But I think we do have a long way to go.
So what are the options if you're struggling, need help?
So I think a lot of people piece together childcare. I think a lot of people find out the cost of childcare and they can't afford it, so they make arrangements. They might have their mom watched a couple of days a week. They might go here a couple of days a week. But a lot of times, those situations are fragile. So people are working and then their mom has to go in the hospital, or the person that they had for backup care isn't available. And then if they don't get benefit time, they lose money. Ultimately, they could lose their job. So it's just that fragmented care is not really working for people, but they don't have much of a choice.
And can I just add to that? So it's fragile and it's emotionally exhausting. So to be the person who is constantly cobbling together, and I know there's a lot of moms in the room, and I see you all nodding, to be the person who is constantly cobbling together a place for your children to be that is safe, that is that you're not worried, that you're not trying to figure out how you're going to get them from point A to point B in time for soccer practice or whatever it is that they need to be at, where you're not worried, where you're not unsure, where you know that they're okay, that they're not worried and unsure. It's mentally exhausting. It's physically exhausting as well. And I think anyone who is a parent who has had to do that knows what I'm talking. I see a lot of head shaking. It's exhausting to do that. So that's also a tax. So it's not just an economic consequence. It's a physical and mental consequence. And if you're working, we were talking about this in our room before. If you're working, that's taking away from your ability to focus on your job. So, we were talking about the 3 p.m. Everybody gets out of school at 3 p.m. and you're sitting at your job trying to do your job, but you're also going, are my kids getting off the bus and going to where they're supposed to be going? And are they, is Jimmy running in the street or whatever it is you're thinking? There's a tax there as well. So it's compounding if you don't have that sort of security in where your kids are at all times.
And I think the part too is we keep having conversations about what it costs for one child. We have people who have a preschooler and an infant, and when you consider those numbers, then you add on the cost of 2 children or after school care and an infant. It really takes those numbers that already seem high and it almost doubles.
Yeah. So I think you're taking the conversation about costs in the right direction. You mentioned resume gap, you alluded to productivity loss because people are not going to work who may be contributing to the economy or who may be going to work but unable to focus on their job as much as they could. And I imagine if we quantified the cost, setting aside even just the emotional cost, the psychological cost, but just sticking with the economic cost, if we were to quantify that, I imagine it would be extremely high and might make more expensive government support for universal preschool and childcare at all ages seem a bit less expensive than it might otherwise seem. Right? Obviously, it's expensive to provide childcare for everybody who can't afford it, but when we compare it to the cost of not doing, simply allowing people to fend for themselves, it might be much more attractive.
I think
Any thoughts about that?